Silus, and today I will be administering an IV medication via a Minibag. An INT is already in place, and there's no primary IV infusion. First thing I will do is implement a standard protocol by checking the doctor's orders and verifying the drug, the route, the dose, and the frequency. I would also assess for any lab values and any history of allergies. So the doctor has ordered 1 gram of Recepin to be infused in 100 milliliter of normal saline in 30 minutes and with a drop factor of 10 drops per milliliter. So after I did my math, I got 33 drops per minute. And since Recepin was only available in 500 milligrams per milliliter, I would draw out 2 milliliters. So the Recepin is bactericidal, and it binds to the bacterial cell wall membrane and causing cell death. It is used for lower respiratory infections. The recommended dose is 1 to 2 grams every 12 to 24 hours. The adverse reactions are seizures and pseudomembranous colitis. It is contraindicated in penicillin, cephalosporins, and for implications, you can do a culture and sensitivity before administration. First administration, assess for bowel sounds, assess liver function by doing ALT and AST, and assess the kidney function by doing a bun and a creatinine. Alright, now I would wash my hands, and I would check the expiration date on my Recepin. Expiration date is good. I would clean my Recepin. Okay, so now using the aseptic technique, I would draw out, I will inject 2 milliliters of air into Recepin. And then I would draw 2 milliliters, making sure that there are no bubbles. Then I would change my needle, and I would get my medication back. Clean the port. Inject my medication. Close this needle. Right, I would agitate the bag slowly so that it can mix, and then I would get my primary IV tubing and would spike the bag. First. Okay. Prime my tubing. So I would have a medication label on the back with the time, date, my initials, the patient's name, the drug, and the dose. And I would also label my IV tubing with the date, initials, and time. Okay. Now I would draw out normal saline. First, I would check the expiration date. Expiration date is good. I would clean the port and clean the bottle. Get a new syringe. Alright, I would inject 6 milliliters of air. Okay. Then I would draw out 6 milliliters, making sure there are no bubbles. Alright. Now I would gather all my equipment, go to the patient's room, and introduce myself. And hey Miss Jackson, my name is Silus. I'll be your nurse today. And the doctor has ordered Recepin for you today. Can you tell me your name and date of birth? And I would verify it with the wristband. And I would ask for if they have any allergies, if they ever had Recepin before, which she has. And then I would wash my hands, put on new gloves. Then I would palpate the IV site for any pain, asking them if they have any pain, any redness, any swelling, or any leakage at the IV site. This looks good. Okay. And then now I will begin my ASASH procedure by cleaning the INT extension tubing, cleaning the port, and I will have my saline. Try and clamp it and get a blood return. Get a blood return. Then I would use a push and stop method to inject 3 milliliters to flush the extension tubing.
Make sure it purges all the air.
Alright. And then I would clean my eye.
Untangle. Unhang the line.
Right.
And then label tubing with the time, date, and my initials.
Clean this port. Clean the extension tubing port once again. Connect primary IV tubing to the INT extension tubing. Then and I would wait for about 15 minutes. Then maintain a IV infusion rate so that it is consistent with my calculated rate of 33 drops per minute. And would unclamp this. Okay. So now I would wait 15 minutes, let the medication run through, and when it's completed I would come back wash my hands again, put on new gloves, and then I would disconnect.
Clean the port.
Clamping it, then I would clamp this here.
And clamp, so I'm gonna make sure behind the patient, doctor's orders are, I would aspirate, check for the hookah flashback, and then after I use a push, the IV site, I'll make sure there's no pause, movement. Slowly check on the IV insertion site for any infiltration or sinus. Checking with the patient to make sure that
I would get my saline and the rest of and flush with the rest of the 3 milliliters.
disconnect the flush. And connect my
Like this
prepared
with the push and stop method, maintaining a positive pressure. If the doctor has ordered heparin, I would use that to flush my my line. Okay. Then I would apply a gator clamp if it was available, just to protect my IV tubing. Right. Then I would dispose all my syringes and my needles into the sharps container. Then I would implement the completion protocol by assessing for pain, if they're comfortable, if they have all their personal belongings with them, and if they have to go to the restroom. I would also monitor the site for any tenderness, edema, swelling, any leakage at the IV site. Looks good. Then I would document on my MAR the time, the date, the drug, the dosage, and the route. And I would assess the patency, of the IV site, to see if there is any leakage, redness, swelling, and then I would document the volume that was used in the Minibag to inject the medication, and also the intake and the output.